Living in the 21st century comes with millions of technological advances to improve everyday life. Many of these advances come within the pharmaceutical industry. However, it seems that every month, new life-changing drugs are coming out with the promise of curing the incurable and improving the lives of everyday Americans. But it seems that lately these drugs that were supposed to be helping everyday Americans by being affordable and effective are now straying further and further away from their initial purpose. To understand the problem behind drug pricing increasing in the past decade, we have to start with the individual who started it all, Martin Shkreli.
So this hedge fund guy, tell me exactly what
founded a company called Turing Pharmaceuticals, and he bought a drug. He bought the marketing rights to a drug and then raised the prices of that drug from $13.50 a pill to $750 basically overnight. And there's the drug. Daraprim is the name of the drug, and it's something that's used to treat a life-threatening parasite illness, infection that people with a compromised immune system can get.
Guilty on 3 counts. Now, before we go on, it is important to make a distinction here. You will remember him for drastically increasing the price of a drug called Daraprim, pushing the price from $13.50 to $750 per pill, making it unaffordable for many of the pregnant women, babies, and other people infected with HIV who primarily use the drug.
Over that hedge fund manager, that guy who bought the patent on a drug and raised the price of that drug by 5,000%.
Martin Shkreli was the pharma bro. He was the poster child for raising drug prices exorbitantly to harm consumers. In 2015, when he was the chief executive of Turing Pharmaceuticals, he raised the price of Daraprim, a popular drug used to combat HIV, from $13.50 to $750 a pill. And while it's true that he's become a household name for his actions, drug pricing around the nation obviously isn't controlled by one company, but hundreds of them. And now it's a problem endemic to the whole pharmaceutical industry itself, in ways the public has not even heard of yet. For example, it's quite likely none of you know who J. Michael Pearson and Valeant Pharmaceuticals are. This company is probably best described as Shkreli on crack when it came to making access to medication inaccessible due to high prices. Their whole business model was based off of buying out innovative pharmaceutical companies that had patents for medication, then using their control of the patent to jack up the prices of the drug. By making profits like this, it made it look like to investors that this company was super successful and profitable as well. But in reality, they weren't selling more units of medication to more people. What they did was reduce their base from which they could get profits, leaving those who could not afford the medication stuck between a rock and a hard place.
However, Valeant and Turing's increase on drug prices is not unique. Rather, it reflects a growing trend in the U.S. pharmaceutical industry. In fact, nominal and inflation-adjusted per capita spending on retail prescription drugs from 1980 has increased from a range between $100 to over $1,000 in the year 2015.
What has caused these pharmaceutical companies to prioritize profits over people? What can America do to counter its drug crisis? These are the tough questions we are going to have to ask amongst the background of rising drug prices. Stay tuned.
Specifically, the rise of drug prices can be attributed to the companies increasing their prices to replace the revenues lost to generic competition on older drugs. A generic drug is a cheaper alternative to a brand name drug. When a brand name drug like Glucophage for diabetes or Lopressor for hypertension comes out, their patent lasts for only 20 years, giving them a de facto monopoly for that period. After the patent ends, cheaper generic versions of the same drug are released. This system made it to where pharmaceutical profit growth is now dependent on raising the price of the monopolized product as much as possible in a 20-year time span. And without price controls or regulation, these brands are able to increase their prices to exorbitant amounts in those 20 years, just like what Turing did.
Now that we know why American drug prices are so high, what are the ramifications of these ever so high pharmaceutical prices? Well, there is a multitude of them.
The effects of overpriced medication are devastating and exact a huge human cost on society. There are three main impacts: medical non-adherence, increased insurance premiums, and an increased operating costs for hospitals. Looking at medical non-adherence, this is a fancy way of saying that as the price of medication rises, less people will be able to afford medication, so they won't take it. Or they may even take less dosages of their medication each time to stretch their medication over a long period of time. But this is potentially life-threatening if people can't have access to medication.
To get more information, we went out into the field to interview some experts. The first person we interviewed was Mrs. Anita Patel, a licensed pharmacist for over 2 decades and a graduate from Rice University.
Have you witnessed any consumers that you've met personally deal with this issue or confronted this issue of the increase in drug pricing?
Yeah, well, so you have a lot of senior citizens who are retired, and if their medications are really pricey, they're not going to fill their prescriptions, right? Or you have a lot of patients who have medications that are well over what they can afford, and then you kind of have to make a choice of what you're going to, if you're going to buy it or not buy it. So it's a serious problem. So the worst thing I can say is at the end of the day, when you have a patient come in and you tell them a certain prescription is going to cost $300, that's the last thing they want to hear. I've had scenarios, I think when I first started working, I had a mom come in and say she had a child that was ill, and I filled the prescription and told her how much it would cost. I think it was like $35 or $40 or something. And this was a young mom. When I told her the price, she was kind of blown away. I think she was thinking it was only going to be about $5. She pretty much turned around and started walking away because she said she couldn't afford the medicine. And that was really hard to kind of watch, because you don't want anyone to not be able to treat their child because of a prescription that I know probably only costs $3, but here we are charging $35, $40 because that's the negotiated pricing.
Then we interviewed Harvard Associate Professor Joshua Gagne and what he had to say about the drug prices.
In the United States, is it a huge problem that we should be worrying about, medical non-adherence, or is it like a lot smaller in scope than we think it is?
Medical non-adherence, you mean medication
non-adherence? Yes, sorry, medication non-adherence. Yes, like people not taking their medications.
Yeah, it's a big problem. So if we take the class of drugs called statins, which are the first-line medication used to lower cholesterol and reduce cardiovascular events, and there's lots of evidence that they do a really good job at reducing heart attack and stroke and mortality as well. After about 6 months, most people, so more than half of people that should still be taking their statin have stopped taking it. So medication adherence is a big problem.
But the issue is not just isolated to statins in people with high cholesterol. In fact, the New York Times reports that medical non-adherence in the U.S. kills 125,000 people every year. This issue becomes even worse for rare diseases, like Wilson's disease, a genetic disease in which copper builds up in the body and can only be dealt with medication. Because so few people have that disease, pharmaceutical companies raise the price of the medication to make a profit off it. That's why the price of the medication for Wilson's disease is $300,000 annually. Even in the best case scenario, if consumers can take their medication but take smaller doses, this is still deadly. It's common knowledge that medication has to be taken at the prescribed dosage to be effective, and not taking it at that level will render the medication useless. For example, for diabetic patients, if they take smaller doses of insulin to stretch their medication, it can lead to diabetic ketoacidosis, which is a potentially life-threatening disease. So obviously, it doesn't help that the price of insulin has doubled since 2012, according to Reuters. In fact, it only continues to rise today. The second main impact from high drug prices is increased insurance premiums.
Obviously, insurance companies are going to have to charge more for premiums for consumers if drug prices keep rising, so that the companies don't lose money. But unfortunately for consumers, that means that insurance will keep getting more and more expensive every year. With that, more people will not be able to afford their insurance plans, and thus companies won't insure them, leaving them to have to foot the full price of medication rather than just a premium, decreasing overall access to medication. Finally, the third main impact of high drug prices will fall on hospitals. Hospitals stockpile medication to have it ready for treating patients. Unfortunately, with higher drug prices, for hospitals to keep a sufficient amount of medication available, the hospital has to become even more expensive. Now, this isn't an issue in areas where people who come to the hospital have medical insurance, as hospitals can pass the cost to the insurance company. But it is an issue when hospitals have to foot the bill because a patient does not have medical insurance, and it is an issue when the hospitals don't receive that many patients in the first place, like in rural hospitals. In fact, right now, almost 20% of rural hospitals in America are at risk of closure, according to a report from CMS data. And the main reason is drug prices. That's because, according to Stat News, increased drug prices has caused hospital spending to rise an astounding 23.4%, and has put a strain on hospital budgets, especially rural ones. That makes sense because in rural hospitals, there are less patients that need treatment on average, meaning the hospital will make less money as they treat less patients. And because in rural areas, since more patients don't have health insurance, hospitals have to foot the bill of the treatment because the patient can't even pay for the treatment, and because they have no insurance company to charge for it. Now this is a big problem, because if rural communities lose their hospitals, they'll have to travel longer distances for treatment. It means that these communities will lose their only access to nearby treatment. Fortunately, there are some solutions.
There is a two-pronged solution that can be implemented to reduce pharmaceutical prices to a humane possibility. The first solution is through the enactment of a single-payer system. In other developed countries like the UK and Canada, a single-payer healthcare system allows one entity to negotiate prices. A single-payer system is more effective because one entity has a large sway on the market and can selectively choose which drugs it wants and at what price it wants.
We then interviewed Joshua Gagne again to see what type of solutions could be implemented to reduce pharmaceutical prices.
So let's start off talking about drug pricing. So drug prices have clearly been on the rise for some time. How exactly should America combat this problem, and what regulatory action should we take?
Yeah, so there's unfortunately no simple solution. Unlike many countries here in the U.S., we don't have a single-payer system, which would allow a regulator to really come in and set some sort of pricing controls. So there's no regulator in the U.S. in particular that's focused on drug pricing and drug costs and cost containment. We have a much more fragmented system in the U.S. than in many other countries. So it's really left up to the insurance providers, and there are many in the U.S., many commercial insurance programs, as well as federal and state programs, both Medicare and Medicaid, for example, that really have to do what they can with their budgets to control drug prices. But one of the challenges is that when, and this may be a lot more detailed than you need, when the Congress enacted the prescription drug benefit for Medicare beneficiaries, which went into effect in 2006 and for the first time actually provided a drug insurance benefit for Medicare beneficiaries. They specifically precluded Medicare from negotiating as a single entity. And now what we have is that there are lots of different Medicare prescription drug plans that are administered by different companies. So even though Medicare is the biggest payer of the U.S., it still would be kind of complicated logistically to implement price controls because it would have to be coordinated across all these different companies that are offering doing the actual administration of the Medicare, what are called Part D plans for the drug benefits. So this is a long-winded answer, but unlike in other countries where there is a single-payer system and they could implement a reference pricing scheme, it would have to be very piecemeal here in the U.S.
All right. Okay.
When Joshua Gagné talked about reference pricing, he was referring to the second prong that can reduce pharmaceutical prices. The way we can reduce drug prices is through reference pricing. It works by classifying drugs into categories based off their therapeutic qualities. For example, aspirin, ibuprofen, and naproxen would all be in the same category. The insurer then pays a single price for any drug in the category. The price of drugs in the category is set by the lowest price or the average price drug in the category. And according to Healthcare in 2019, this type of reference pricing actually incentivizes the creation of cost-effective drugs. For example, companies, if they create a new and innovative pharmaceutical drug, it can be placed into a higher category. And if it's placed into a higher category, it will garner a higher price. And with this higher price, the pharmaceutical company can actually get more revenue. But at the same time, it also incentivizes the pharmaceutical company to create cheaper drugs. Because the cheaper the drug, the lower category it will be placed into, and the more consumers it can reach.
So far, we have seen the issues. We have seen the real harm that Big Pharma can do. But we have yet to see the solution. Fortunately, Congress has already taken initiative to solve this epidemic that is ravaging the United States. A prime example can be seen through the CREATES Act, a piece of legislation that aims to reduce the price of pharmaceutical medication by allowing generic drug companies to get samples of pharmaceutical medication in order to produce it at a cheaper price. As of now, pharmaceutical companies won't sell samples of their drugs to generic drug companies, who use the original chemical properties of the pharmaceutical drug and further innovate the product. Essentially, if the government can provide and prevent the pharmaceutical companies from holding back their products specifically from generic drug companies, this would dramatically expand the drug market and spark innovation within the industry. Moreover, the Federal Trade Commission, or FTC, and the Food Drug Administration, or FDA, are teaming up to strike back against the pharmaceutical patent monopolies by using the FTC's legal expertise and the FDA's scientific expertise. Even our own Senator Ted Cruz from Texas has proposed legislation called the Results Act, which lowers the amount of regulations on medication approved in other nations in order to import the drugs into the United States. Granted, there is already legislation being debated on top of Capitol Hill to solve these issues, but that doesn't mean we can just sit back and relax. Because after all, the worst action is inaction. Democracy isn't just a spectator sport. When we realize the wrongdoings of corporations, it's within our hands to fix the problem, voice our dissatisfaction, and bring justice to thousands of Americans who deserve it. An industry that is wrought with corruption, exploiting the lives of innocent constituents around the country, needs to be stopped. Let's not feed into the greed of Big Pharma and instead rein in on an industry that is out of control. Democracy is based upon the conviction that there are extraordinary possibilities within ordinary people. It's time that we as Americans fulfill our civic duty and realize that we must become aware of the malpractices of Big Pharma and begin fighting back with our votes and our voices. Because after all, democracy may be the bane of Big Pharma, but the boon for humanity.